Madam President, Excellencies, we are here today in Geneva as a part of an annual pilgrimage for health. I came from St. Vincent and the Grenadines with a message for you. Our country believes that the theme of this general debate is timely and appropriate: universal health coverage, leaving no one behind. The latter part of this formulation, leaving no one behind, is reminiscent of a slogan associated with the Sustainable Development Goals, and therefore brings into sharp focus our obligations with respect to SDG 3 on ensuring healthy lives and promoting well-being for all ages. Furthermore, universal health coverage, we know, is an overarching ideal that commands the nations of the world to work in a united way to ensure that ever-improving health services can be accessed by their respective populations, recognizing that health is a fundamental human right. It cannot be overlooked that this assembly is a forerunner to the upcoming high-level meeting on universal health coverage slated for September at the United Nations headquarters in New York, in much the same way that John the Baptist was forerunner to Jesus Christ. I presume that health will have its savior. St. Vincent and the Grenadines is unequivocally committed to universal health coverage. In fact, we are currently putting in place the infrastructure necessary for the strengthening of national health services through various international financing and technical cooperation agreements. We recently opened several healthcare facilities, such as polyclinics, a modern medical and diagnostic center, and what PAHO calls a smart hospital, defined to be a hospital that is safe, green, and climate resilient. These recently commissioned facilities helped us to go a long way towards a health system built on the foundation of access and equity. This has also meant an increase in the size of the health workforce in the communities. There are more boots on the ground, so to speak, to help us in our war for health. Madam President, we understand that tackling non-communicable diseases is important for universal health coverage, and we are persuaded by the logic emanating from PAHO's High-Level Commission on Universal Health in the 21st Century, 40 years of alma mater, which says that investing in primary health care is the best way to achieve universal health coverage. The investment must impact the factors that have a bearing on universal health coverage capacity, such as human resources and technology. This is precisely why our country has embarked on a very important capacity-building project for the prevention and control of diabetes that provided training for health professionals and critical equipment for our primary healthcare centers. This action is supplemented by other initiatives and measures aimed generally at reducing NCD risks, including increased taxes on tobacco products, alcohol, and sugar-sweetened beverages, as well as promoting heightened levels of physical activity. Madam President, I would like to emphasize that we cannot allow a product like sugar, with its links to the horrible history of slavery in the Caribbean, to destroy our contemporary lives by making our children fat, vulnerable to infection, and ultimately susceptible to non-communicable diseases. Essentially, Madam President, St. Vincent and the Grenadines is committed to action geared at addressing all our various health problems and removing the obstacles on our path to universal health coverage with international support and solidarity. Time does not allow for elaboration. Madam President, in the spirit of our theme, which I remind you is universal health coverage, leaving no one behind, this august body should review its position on the participation of Taiwan at the World Health Assembly. I do not think that anyone would seriously suggest that the 23 million people who live on that island are represented here. This creates a dangerous and undesirable gap or void in the global health network, undermining public health and safety, and is contrary to the very notion of universal health coverage that we defend. The gap should be closed. Madam President, It is my wish that the people of all the nations of the world will prosper and be in the highest possible level of health. Let's keep working towards that goal. Thank you.